Now, moving further, we have yet another panel discussion to host before we honor and reward the healthcare all of you recipients. Have you ever wondered how technology is reshaping the landscape of healthcare? Well, I have, and I know most of you have too. Well, thank God, because our next panel will cover the topic of the power of technology in blended care, exploring telemedicine, remote monitoring, and digital health solutions, meaning that we won't have to stay stuck with the question anymore. Help me and welcoming our moderator, Dr. Umar Khan, CEO of iMed Health LLC, and our panelists to the stage. Come on up, guys.
Thank you so much. And this is, I believe, a very important topic. And digital health is what we have been experiencing for the last couple of years on steroids, given that we had COVID sort of lead the way for us. And the global digital health market is valued at was valued at around 200 billion in 2022. Now it is actually expected to reach around 1.5 trillion by 2032. So there is a lot to go forward with, and I would like to introduce my panel. And we have people from different backgrounds, so we're going to be in for an exciting discussion today. So first we have Michelle Di Stefano. She's the co-founder of SOAR Executive Coaching, and she also has worked with various roles to implement different digital health technologies in her leadership roles. Michelle, can you provide a brief introduction?
Sure. I am the CEO and founder of SOAR Executive Coaching for Healthcare Leaders. And what I do is I work with teams and also individuals to empower them so that they can empower their staff to get great positive patient outcomes. And I work with a lot of innovation across the United States, located in San Antonio, but have my practice throughout because of Zoom.
All right. Next, we have Jasmine Burns, who is a licensed psychologist. And as we know, she had a talk a little bit earlier today. She is a autism care telehealth provider with a roaring business. And let's see what you have to say about yourself.
Hey everyone, you know me, Dr. Burns here. And thank you to my friend in the back for the jacket. So yeah, as I talked about earlier, I'm really specializing right now in autism evaluations and immigration evaluations and really just trying to empower families and providers in, supports and services for themselves and for their children. Thank you.
All right. Next, we have Kramjit Kaur. She is a former health tech government contractor and a patient advocate as a result of her own health issue. Kramjit.
Thank you very much, Dr. Khan. Hi, everyone. My name is Parmjeet Kaur. As Dr. Khan just mentioned, I'm an entrepreneur and I'm a government contractor. I've worked in health tech for about 20 years, mainly with a lot of state agencies. Uh, and so, again, but mainly in the Medicaid space. Why I'm here today is I am a patient. So I bring a unique perspective to this panel in that I was diagnosed with multiple sclerosis in 2008 at the age of, actually, I won't tell you my age because then you'll do the math. I was diagnosed with multiple sclerosis when I was 24 years old. And I saw firsthand, not just as a vendor, I saw firsthand as a patient the complexities of our healthcare system. And being that I myself had experienced so many challenges, and mind you, I'm knowledgeable about healthcare, I thought to myself, if I'm experiencing all these challenges, what challenges must the rest of the community be facing who is unfamiliar maybe with the healthcare space? And so, again, so I'm a huge healthcare advocate, I'm an entrepreneur, and yes, I will be doing a test at the end of this on the pronunciation of my name.
I think I scrambled her name. All right. Next, we have Ankush Khona. He is a healthcare technologist with over 20 plus years of experience working in the healthcare space and working with startups.
Thank you. Um, can everybody hear me?
Bring it
Yeah. Hello, everyone. My name is Ankush Khanna. I predominantly work in the healthcare tech space, serving health startups. I was a former chief data and AI officer for City Block Health, which focused on Medicaid, Medicare, duals population in New York City, and now continue to on the journey, helping the rest of the startups trying to become data driven and really understand the impact of AI and how you can leverage these technologies for the betterment of health outcomes.
All right, great. So telehealth, blended care. So how did we actually get here? So we are in this age right now, but back in the 1940s, there were radiology images actually sent over by a telephone line in Pennsylvania. And then as we move forward, University of Nebraska, I believe, was the first university in 1959 that they actually had video visits. So when I think about that, I started my telehealth journey in 2015. I was advanced, but this was going on much before that. But now we know that telehealth and remote care and digital health has been expanding, and numerous technologies are now that we are noticing. So Michelle, I have a question for you. So different devices are now what we are experiencing. One is, of course, Health Logic and the Dexcom continuous glucose monitoring devices. How do you feel that these are actually bringing out a change in chronic disease management?
Sure. Well, I'm going to ask you all a question because when I was preparing for this panel discussion, had a flash from my past. Okay. And so looking around you, I think that you all probably had the same flash as well. But it was even less than 20 years ago. And I remember heading up, I'm a nurse, and I remember heading up a cardiovascular institute for heart failure patients. And we were doing great things then. Now, remember, this was not even when an EHR was implemented in my 555 bed hospital that was a teaching hospital in Pennsylvania. But we were doing great things. And in this clinic, it was run by nurse practitioners, nurse led clinic. And then I also had to have nurses that were on the phone calling these patients if they if we got through to them, if they had the right phone number given to us, right? And we were asking them what zone they were in for heart failure. And we still thought we were doing innovative, creative things. Well, we were, but that's what we had at the time. We logged all of our data by manually, and then we had to prove our outcomes because we were a costly clinic, administrative above me, right? Very costly clinic. Okay. We didn't know how many lives we saved. We didn't know if we really were decreasing admissions to the emergency department or keeping our beds open, right? Because it was just all manual and we just were doing some great things here, right? So, coming back to now being on the other side, where I actually had the pleasure of working for a med device company and was a consultant for that, it was Boston Scientific. And we were in just about 5 years ago rolling out Heart Logic. And this was now a remote system that was able to detect by sensors the exact red, yellow, and green zones of our patients that were manually documented. But there was a trigger that we could work on and the healthcare provider would get the information, the patient would know exactly what was happening to them, and we would call them back immediately. So this has really improved patient outcomes, obviously. It has given us real time information and data management. And it also has decreased the amount of times individuals are going into our overcrowded EDs, right? And they might not be seen right away, and also decrease some of the bed utilization. So it has definitely been a very positive innovation.
No, definitely. And heart failure patients returning to the hospital within 30 days. Now, some places, I think 7 days readmissions are also being discussed. And hospitals get dinged if the patient comes back to the hospital within a certain period of time. So all these devices need to be worked on, and new data needs to be, gathered so we know what works and what doesn't work. Excellent. So, Jasmine, you are in this space, the autism and the behavioral space, telemedicine. You are doing this. You are on the ground, and you are in the forefront of all of this. But there comes a question that, with regards to behavioral health, and especially with children that you deal with, how does telehealth actually? What could be the pros and cons, and that you can come up with, and what you experienced?
Telehealth is not for everyone. Okay. No one size fits all. We've talked a lot about that at the conference. So, pros. I love working with kids via telehealth because I can see them in their home. I can work with them in a naturalistic setting. versus them coming into a clinic or a hospital settings I've worked in and them being like, well, where am I? Like, what is this? Remember, I'm working with autistic children, neurodivergent children. Change is hard, change is scary. And so when I was working in those settings and the children would come in, they would clam up. They wouldn't talk, they would cry, they would be hitting themselves, and I wouldn't be able to get the information that I needed. I would have to, ask the parents to maybe like come back another day so that, the child can basically just try again, if they were in too much distress. So with telehealth, I'm able to see them with their parents. They're playing with their little, Barbie dolls or whatever, and they're comfortable because they feel safe. And because of that, I see them just like, their parents see them. So that's a huge pro. But again, I do work with, individuals across the lifespan. And so there have been older adults, for example, that I work with who aren't as tech savvy. And so if that's the case, we refer to an inpatient, or excuse me, not inpatient, in person provider near them, right? Sometimes people refuse and they still want to see me via telehealth, and that's fine. But being able to see someone in a comfortable setting so that they can just open up where they are, it goes a really long way, and I'm able to really see and hear where they're coming from. And so it's really helped kind of meet the client where they are.
Excellent. A follow-up question for you. One quick tip on how to orient a child via when you're doing a video call. What do you do?
Humor, visuals is really big, and breaks. Build in your breaks to your evaluations. So there's many times that I'm starting my appointments with a clinical interview, and I'm talking to the parents. This is if I have like a little kid, especially a kid who's non-speaking. And so I'll ask the parent to kind of angle their camera so that I can see the child playing in the background. Because for that hour and a half, however long the interview is, I'm getting robust information, right? Both from the clinical interview, but from what I'm seeing the child doing in terms of their play, their communication, if they want a nap, and how they request for those things. So if you can build in breaks and just kind of orient the family and the child ahead of time, that's really, really helpful for these appointments.
Great. Hopefully, this helps us out for other telehealth appointments as well for children. All right, Paramjit. So this leads to a question for yourself. Um, from your standpoint, what are the main concerns from the patient experience standpoint by the use of telemedicine?
Okay, so great question. I so I'm going to share a little bit about my personal experience. So my family is from India, and my father uh, doesn't speak English that well. Doesn't use online banking. He still likes to go to the bank, interact with a human being. He still writes checks. Uh, so if you were to tell him, while telehealth is great, especially right after COVID, I myself had a lot of telehealth visits, and I valued them immensely, and still do. For individuals like my father, or perhaps other immigrant populations, or maybe older populations, telehealth, while it's great, not everyone, number one, knows how to access technology to access their telehealth visit. And then there are some individuals like myself who still prefer to see a provider in person. I mean, how many of us have called, whether it's AT&T or whatever the case may be, and you get that automatic robotic response? How many of us have shouted representative into the phone? I'm one of those individuals. I like that human interaction. But again, what I see again, my father is never going to use telehealth. My mother is never going to use telehealth. And even me as a millennial, I'll use it if I have to, but I much rather have a face-to-face visit. So I think moving forward, I think there is going to have to be a blend. So telehealth, but we're also still going to need to have these in-person, authentic visits with our providers.
I know, definitely. So, I believe that telehealth is here to stay. For just to give you an example, if anybody has had kids, right, and your first child, right, what happened when the kid had their first fever, first rash, first episode of diarrhea, or they're crying endlessly. You are saying, who can I talk to? I need to talk to a pediatrician. What's happening? You're gonna call your doctor friend. Hey, what's happening? What can I do? So there are use cases, some more than others, and we'll figure out as we move forward what are the best use cases. Ankush, so we talked about implementing health systems within populations and hospitals. We talked about autism care. We talked about the patient perspective. All of this technology is at the back end. And now what we're seeing is AI is going to be embedded with all types of technology. So how do you see AI in this landscape of digital health and blended care?
Yeah, I think I mean, if you just take a simple example of all the examples that were given, I think telehealth might not work for urban cities, right? Probably. But I mean, if you look at the value telehealth brings into, or the digital health is for remotest areas, and there are a lot of these places where the providers cannot really physically reach, and health is impacted. So, I mean, in the era of AI, and we look at the number of sensors, the number of devices that are getting connected. Um, we actually ran a use case where uh, a patient was stuck in the most remotest area, um, and had a episode and had to be quickly diagnosed. So we built this entire solution for this organization, where um, with the help of additional capabilities like 5G network, all of these coming together, a patient just calling the doctor, having a video call, taking a look at their episode, immediately getting diagnosed, immediately getting auto um, select, meaning like, auto authorized to getting admitted to the hospital, airlifted. So an emergency notification going to the helicopter operations out there. So all I mean to say is, look at this end-to-end connectivity of data and being exchanged at different points. AI is now making that more and more achievable, and at a scale and at a speed that previously just wasn't possible. So I do believe that, as we continue to mature some of these emerging technologies, I do believe that it would really help, especially for people in the further remotest areas that unfortunately just do not have access to, quality care, and quality healthcare.
No, definitely. Talking about remote areas, and as we're talking about, there are going to be different use cases. So I remember when we were working with local stakeholders in Nigeria and Pakistan, connectivity was a big issue. But the bigger issue was that there are no doctors in that town. There are no nurses in that town. So we had a system where we had a stethoscope integrated. We had blood pressure, glucometer, everything integrated at a local health unit where there may be a nurse, just a nurse that has little experience, but on being trained, a patient can be examined remotely, and sometimes the patient experience need to be recorded, and sometimes it would even live by the hotspots that we were using to get connectivity through. So remote care and is different from urban care and is needed, and AI will certainly play a role in screening patients moving forward, who needs to be seen when, and when does a doctor need to talk to the patient. Michelle, moving back over to you, since you have so much experience in implementing in a hospital setting, in a clinic setting, what are the biggest issues and that you have faced actually getting things implemented? And one thing is having a product, the other thing is actually having it work on the ground and you get what you need from it in return.
So, what was very interesting in my career, having worked mostly in acute care, and then moving over to medical advice and being a consultant and making sure that patients were in compliance and rolling out these technologies, um, it really did show that some of the challenges were our patient selection, and then also the stringent education of providers and patients about this new technology. But what I did see when you partner with medical device companies is that there is this breaking down the silos where you have the technicians, you have the individuals that actually, um, were the architects of this device. And then you have the clinicians in the medical device space, and then you have the clinicians in the hospital space. But this is definitely flow mapping and definitely having a plan of how you're going to integrate this remote monitoring. So, for example, if the monitor goes off and if a sensor goes off, particularly in heart failure, who's going to receive that signal? You have to map this out and you have to have strategies for Lean Six Sigma projects, those kind of things to ensure that the patients are well equipped. Also, just like telehealth, you have to ensure that the patients are set up. Do they need internet or not internet with remote monitoring? And what are some of the other devices? And also the cost of these innovations, because once again, there is demographics and things that some patients may not be able to have this device ready at their hands. But I really love the integration. And if you really have this as a big project plan and work alongside medical device companies as well as the clinicians, that you can really have a great product that's effective for the patients.
Excellent. Yeah, definitely. It has to be set up in a manner to get the results that you need. And so many issues you have to look at when you are exactly looking at the patient experience and the data and how you're going to be managing the patient. Jasmine, so with regards to therapy patients, what change have you noticed, and how has telehealth, given your experience, actually brought about a change that you are seeing?
I'm noticing that patients are showing up to their appointments, right? Um, because I've worked in community mental health, I was working with a lot of patients who didn't have access to a car or money for a bus. They had to choose between, are they going to have a meal tonight or are they going to go to their appointment, right? Um, when I was working with that population where those basic needs were barely being met, there was a lot of no-shows. There was just, they just would not turn up. Um, but with telehealth, because I'm in their car with them, basically, I'm in their home with them, they just pop on camera and they're there. Sometimes I people need to always be dressed for their appointments, right? But sometimes people get a little too comfortable in telehealth, but they're showing up, right? And they're invested.
Pajamas or no pajamas? There's
No, well, the pajamas are fine. It's fine. Just show up. But yeah, so I've been seeing a lot more patients showing up, and because they're in their comfort zone, whether again that's in their car, sometimes in bed, they are able to be present, more present. And because of that, we can go deeper in our work, whether it's a therapy session or an evaluation. I can really go deeper with the patients. And those outcomes are really, really important, right? Because we know that if you're doing therapy and you're showing up once every couple months just because of whatever is going on, you're not going to see the healing happen. But if you're being consistent and showing up to your weekly appointments, that's where the healing starts to happen, right? And so telehealth has been amazing, amazing for that and for that accountability.
right. Excellent. So, Pramjeet, AI, as we are talking about AI as well, so there are numerous challenges, right? And we know from the clinician standpoint that there is AI at the back end, but patients haven't truly experienced AI as a user, at least currently, not in such a vast scale. But what could be the challenges from the patient perspective about AI? Are they okay with the advice given by AI? Do they trust AI? What do you feel about that?
Sure. So I think there so it's different things. So number one, I think AI can be helpful for individuals. Again, going back to not everyone's comfortable using technology, but for individuals that are comfortable using technology, I think AI is amazing. Uh, a lot of times, there are a lot of patients, myself included, who maybe don't know the questions to ask of their physician. So AI is a great tool for that. You can input into the AI tool. So let's use Chat GPT as an example, because I think almost all of us are familiar with Chat GPT. You can input what your maybe diagnosis is into Chat GPT and give it a prompt that I'm meeting with my PCP, my primary care physician today, and these are some of the symptoms that I'm experiencing. What are some questions that I can ask my PCP during my appointment. What are some things that maybe my PCP should focus on? So I think from that aspect, it is helpful, but there are also dangers with AI. So a little bit more about my background. I currently work as a contractor for the city of Las Vegas. And in my work with the city of Las Vegas, I am actually the open data committee lead. And so I read a lot of policies, a lot of legislature around artificial intelligence. And what I'm finding is that AI bias and AI discrimination is definitely a thing. And so AI doesn't always recognize the differences in culture. It doesn't always recognize, uh, I'll give you another example. AI might say that for this, again, using myself as an example, AI might say for this female that is this falls into this age group from this community, this health plan would be the best fit for her. But again, it may not be the best fit, but AI is relying on discriminatory data. And unfortunately, AI, uh, it affects um, communities of color and oppressed communities more than, let's say, the Caucasian community. So I think AI has its benefits, but there are definitely dangers to using AI. And I think, all right, as I'm reading legislature, as I'm reading policy, I see a lot of hospitals, a lot of physicians are using AI to help diagnose patients, to help treat patients. But again, it's a double-edged sword. You also have to be careful that you are not that there is still a second opinion. The physician is still meeting with the patient, and the physician is still the one diagnosing the patient, because if you are using just data from AI, you have to remember there's that discrimination and that bias that plays a part in what the AI's output is. So
So,
yeah.
for any entrepreneur over here, and note to myself as well, she is bringing up a problem, and a problem that there is a huge room to improve upon. So anybody can work on that, and maybe get in touch with her about what is she seeing on the ground about this huge problem that we are hearing about, but haven't particularly seen anybody is working towards. So somebody who wants to work on that, that'll be, I hope that will be successful. All right, so Ankush, so we talked about all of these technologies, and with my own experience as well, you have a product, and a vendor could be coming into a hospital system, but they may not be able to communicate with each other. Interoperability is a huge issue in healthcare and has been there for a long while, and legislation is catching up, but it's not there yet, and providers and vendors and entrepreneurs need to work on that. How do you see interoperability still being an issue, or it's much less of an issue right now?
Yes, I think in terms of interoperability, there has been significant progress made, I would say, in the last 3 or 4 years. If you look at the CMS mandates in terms of exchange of information between the payers, the providers, between payers, between tech vendors, I think it's definitely in the right direction of transparency that we unfortunately are all getting hammered by for lack of transparency by most of these organizations. So I do believe that I think there's a lot of progress being made from a regulation front. I think where it starts to break apart is these multiple touch points between several stakeholders within the healthcare journey of a patient, right? So I mean, if you have to compare to a financial organization like a bank, you just go to a bank, or you would go to an ATM that is still owned by a bank. So you fundamentally don't get discriminated by the services. But in healthcare, it's not the case, right? I mean, you have to have a payer provider, there is pharma, there are pharmacies, there are community centers, FQHCs. Just the list keep the list keeps continuing to go on, right? So I mean, if you look at an average patient's touch point across its journey, it's a lot of handshakes of that information that happens today. So I do believe that as we continue to mature these these capabilities, ability to exchange information seamlessly between these vendors, and between the key stakeholders. I think that's where the biggest, I would say, transformation will happen, in my opinion. And I think we'll have to continue to wait and watch in terms of how these mandates and regulations force a lot of these stakeholders to really become more transparent in terms of providing services to the patient.
Right. As a follow-up question to this, so big EMRs such as Epic, Meditech, Cerner, how have you seen or what has been the progress between connectivity between them?
So I think if you look at EMRs, like Epic is a great example. I think it's one of the most complex. I mean, if you look at Kaiser Permanente, one of the biggest national health network, poured in almost $1 billion to even implement its own EHR system at Epic. Um, but if you look at the complexity in the end to end, I mean, EHRs are complex, but I think again, the integration of care management systems with EHR, digital health sensors, EHR solutions. I mean, if you go to an help integrate these data sets, but because nobody follows a standard protocol, I think the integration of these data sets are very complex in nature, and you are continuing to add more and more newer types of, I would say, data sets. That is also increasing in complexity. So, in my opinion, again, just going back to your question around EHR, EMRs, there is a large effort that is taking place right now as we speak within the industry for integrating these digital tools and these devices directly with these EHR capabilities, along with care management solutions and any other that is required to manage the care of a patient.
Right. Michelle, I think maybe you can shed some light on this with your experience in the industry. Um, you have a product, right? And there are multiple EHRs. How do you go about working with them?
Multiple EHRs. The multiple EHR scenario is still pretty much challenging in healthcare organizations, and a lot of times the outpatient is not connected to inpatient, and then all the other outpatient practices. So if you're not within the same healthcare system, and if you're what they call an employed and not employed physician, which I find that fascinating terminology, but if you're a physician that doesn't work for a certain healthcare system, there is a struggle for that. However, one of the things I did execute and implement in my consulting was a health exchange, HIE, and that was bringing in all of the diagnostics and radiology into one platform so that the physicians and practitioners could get the information on real time. But it's still to this day, as far as we've come with these big names, even as Cerner and Epic and everything, they're still working on this to have the connectivity throughout all the system, the providers, because we do have multiple specialists and we also have GPs, and everyone needs to be connected with the patient.
Yeah, there's again a big room for improvement,
Yes.
and and I use Epic, Meditech, and Cerner, and even obtaining records of the same person from a different location, out of state perhaps. It's a visitor to your town, perhaps, right? You don't get the exact, you don't get everything. You get it in piecemeal, and it's you have to go through the record to actually get you want. Good point. Um, so Michelle, I do have a question for you. That we talked about these remote technologies, and you talked about Heart Logic as well as Dexcom. And with the advent of AI, how are we seeing these technologies and other technologies change the landscape as we move forward? Can you please?
Sure. So we've talked a lot about AI throughout this entire conference, and so one thing with remote monitoring is that AI can actually help with increasing, enhancing predictive analytics, and so that we would have our data earlier detection. And I also believe that with remote monitoring our sensors, they're going to be developing better sensors now that are going to have a lot more parameters to be monitoring as well. And what I do believe is going to happen is that we are also going to see remote monitoring probably get to other patient populations. We talk a lot about the chronic illnesses of diabetes as well as heart failure, but also can it go into mental health and also post-operatively. But I do have one major, plea that we've been saying throughout this conference, and being a transformational coach as well, it's the same with my clients when I'm coaching them. But if behaviors don't change, results don't change. And so, while all of this analytics and everything is powerful, we still have to have those practitioners and providers, nurses at that bedside with that patient to help transform this. I have a very transparent story to tell you. I was privileged to have my 29-year-old who moved to Cali, which I'm really glad she moved that far away because she is a diabetic right now after removal of her pancreas with a benign tumor. So she went into full fledged diabetes. She is a non-compliant patient, and I had the pleasure of watching her have some sugary drinks when she was with me. And she was just with me for a long weekend. It was long enough for me. And I'm a nurse, I'm married to a physician, and she had her Dexcom on. Her blood pressure shoots up. Okay. She then nicely gives herself insulin, and then she bottoms out, all within a parameter of maybe 3 hours. So the doctor and the nurse, mom and dad, were at their wits' end. Okay. So when she went to see her diabetes specialist, there was no conversation of watching what was happening to these lab values. Now I'm trying to coach her. Okay. But when she went back, I love her, but I was glad she went back. So we do have to change behaviors. We have to make sure that we're on the forefront changing these behaviors.
No, definitely. Actually, she was talking about compliance. And when I started working in the hospital setting, I noticed, and that's how my health tech journey started, that patients were coming in sick, diabetic ketoacidosis, perhaps, strokes, seizures, forgetting to take their medication. And there comes a point due to certain circumstances that you do need to be on top of your game on this point. So I developed a medication reminder application, and I tried to put in measures that you get alarms, of course, and what were you doing when you're taking this medication, or what was changing, anything you were sleeping, running around, whatever, to try to get a bigger picture of the whole situation and the doctor can later look at your record and see what is actually happening instead of trusting your memory as to what led my sugar levels to rise or drop significantly, and now I'm with hypoglycemia in the hospital. um, Jasmine, so from the blended healthcare perspective and from the collaborative approach, right? A patient coming to you via televisit is probably seeing other clinicians for different matters, right? Um, with your experience, and you probably need to communicate with a primary care physician, or possibly if the patient has been admitted for some reason to the hospital. How has your experience been with actually communicating the whole net for your patients and different touch points that the patient has to go through?
I'm going to be honest. By the time patients are coming to me, they have been um, traumatized by the healthcare system. There's a lot of mistrust in the healthcare system. And I think part of that is because we are still, I mean, there's a lot of things, but one of the issues I think is we're too siloed. We are too disconnected. We are all trying to help the person, right? And we need to start working more together to fully help the person, to fully see the person. And I know that there's many times my patients are like, I've already told my doctor this. Like, can't you just get the records and read it? And a lot of times it's re-triggering, it's re-traumatizing to share their story over and over and over again. And it just leads to a lot of frustration. So what I typically do is I'm like, give me your doctor's information. Give me their email, their number, the records that they've given you. I'll read it, I'll go over it, and I'll explain it. Because that's another thing that I'm noticing is a lot of doctors, I don't care what part of healthcare they're in, they're not communicating results. They're not communicating a lot of things. And so you're having patients jumping through these hoops, not knowing why they're jumping through these hoops, what the hoops are going to lead to. And so when I work with families and patients, I'm really trying to synthesize everything for them. I'm trying to again meet them where they are and I'm like, okay, this is what you've done so far. This is what you should probably do next. Let's create an action plan together. So that's become really important in my work and just again and really empowering the people and educating the people that I'm working with. And then on the provider side, I'm really trying to advocate and be that that patient's voice. Like, hey, they didn't know that, whatever X, Y, or Z happened. And so I think the more that we can talk to each other as providers, the more it's going to help our patients.
No, absolutely. And I'm just remembering something that I worked with clinic system, all cardiologists out in Florida, and their patients were in and out of the hospital. And it was too much work for them to actually work with the hospital system to get records and to be notified when the patient is in the hospital or the patient relayed their health information with the hospital system. So they has developed a program where the patient will let them know, press a button that, hey, I'm in the hospital, and all the records are on their mobile application. And the doctor knows that, hey, I'm not going to get a call from the physician because the physician may forget or not even bother to talk about their health issues. So yeah, this is a big issue about everybody connecting, and it has to be worked on, definitely. Pramjeet, so we're talking about AI empowerment to our patients, but there are of course huge issues. How much control does the patient get, right? How much value will the patient actually get from all of this? Um, but does this also impart us, or will it impart in the future a sense of connectivity with the healthcare system and further wellness for the patient with regards to AI and healthcare in this?
Yeah, absolutely. And before I answer that question, I just want to thank you, Jasmine, because the work that you do, I think it's instrumental. And I think, I mean, I think about myself when I first got diagnosed with MS and the challenges that I went through with the healthcare system, and having had I had somebody like you in my corner, it would have made such a difference in my healthcare journey. So I just want to say thank you to you.
Get our contact information.
Yeah, yeah. Um, so, okay, I'm sorry, can you say that last part one more time, please?
So how AI improving wellness for the patient and actually bringing about the change and more control for the patient themselves.
Sure, absolutely. And I think it goes back to what I was saying earlier about using Chat GPT for a patient being able to use Chat GPT to get an output of data as far as questions for their provider. Because a lot of times, and I've spoken to, so again, right, I've worked in healthcare for 20 years. I've spoken to a lot of physicians. I've, done EHR and EMR implementations. And what I hear from a lot of the physicians that I speak to is, well, the patients aren't asking the questions. I didn't know so and so. I didn't know this and that because the patient isn't telling me, or the patient isn't asking the right questions. I think it's because the patients don't always know, again, what are the right questions to ask? How should this conversation with my provider go? And I think AI is going to be instrumental in helping patients and providers foster that collaboration, that much needed conversation. I also think that it is, again, going to help patients maybe even understand their symptoms. I will preface with this, but we still have to be careful because, again, going back to what I was saying earlier, AI discrimination, AI bias is a thing. So we always have to verify and validate the output from the AI to whatever technology it is that you're using, whether it's Chat GPT or I think Bard is another one. Uh, I think it is going to be immensely useful, but while also remembering again that we have to validate that information, because a lot of the information that AI is outputting, that's pre-existing data. And it's kind of, I say AI to me is like Wikipedia on speed, right? You have to remember anything you see on Wikipedia, that's data that humans have put in, but that data isn't always it's not accurate. There are a lot of inaccuracies in the data. So yeah.
Yeah, so information is there. I think companies are working on people using AI in a more targeted manner than just Chat GPT right now, and hopefully we have more targeted AI products for individualized patients. Okay, Ankush, very important behind all of this, right? Digital health, blended care, everything else. Now we have sensors, AR, VR requiring higher bandwidth, more connectivity, 5G, maybe 6G. Are we there yet? Is if a startup has 10 clinics, but they are going for 1,000 patients remotely, is this workable in the current environment? the
Yeah,
scalability and the bandwidth. Yeah.
yeah, I do believe that, I mean, technology has evolved significantly in the last 15, 20 years for organizations to scale much faster, much quicker. I mean, look at pandemic as an example where, in matter of days, organizations were able to create digital health solutions and roll it out across the country, across the regions, across the globe. So I do believe that I think technology is there. I think it's just a matter of time in terms of, the how and what's the need in terms of scaling it out. I do believe that when there are major health events like an epidemic or of that nature, I think it will allow more scale very quickly. But um, but I do believe that technology is there, and I think it continues to evolve and become better and better from where we are today.
Excellent, excellent. We have a few minutes. If anybody has a question, please. Yes, the lady in the middle. How much education? Yes, I think it's yeah.
Well, so education is I think it's a concept, and I know that when we do educate patients, it's really about how are they processing, and some of the biggest techniques is teach back. And it's not just about giving brochures and having them sign a form for JACO compliance, all that kind of stuff, but it is definitely ensuring that what they heard and they know how to, by asking questions that they're going to respond back and say, now tell me how you put this apparatus on, how do you use this remote device, that we have to really be assessing that. There's this overarching piece of education. I know that we spend a lot of time on, we think we're educating, but we're not. The other thing about educating patients, particularly in a time of a diagnosis or crisis, they're not listening. And so this is where we really need, what I'm really hoping for AI and all these other great technologies is that we don't talk about removing um, people, and that we take those people and our providers and we put them into now what is needed to take care of these patients and making sure they have an understanding for their healthcare so that they can be in control. Okay, because for me, after when I had stroke and everything else, patients, there was no way upon discharge that they were hearing how they were going to take care of themselves or how their loved one's going to take care of themselves. They're traumatized. And I would have loved to be able to have a system that I could have brought them back into our clinics and like a week later, 2 weeks later, still check in with them, but then figure out where they are in the process so that they can hear and they can change behaviors, like I said.
So for me, education is all about empowerment, right? And Michelle, what you said is it's so important, right? Because we need to teach our patients like what's going on. With my work, I do feedback sessions. Like, okay, here's your report. Let's talk about it. What questions do you have? Do you understand what your diagnosis is and how this could impact you, right? The next steps. Making sure that when you're educating your clients, your patients, you're doing it in a developmentally appropriate way. If I'm working with someone who has a lower IQ, I'm not going to be using big words with them. You know, I'm going to be using visuals. The way I did my presentation today, for those of you who saw it, I put in words, I put in videos, I use certain colors. I did all of that for a reason because everyone learns differently. So if we can educate in a way that the client is understanding, it's going to empower them to know what to do next or not do next. And so I think as providers, if we can do that just a little bit better in the healthcare system, it can really help patients in the long run.
All right. Thank you so much, everybody. If anybody has further questions, you can reach out with the panelists. Thank you.
Thank you. Fantastic job, guys. Thank you for your time and energy on that.